Good afternoon, everybody, and welcome once again to the Manchester and North West Districts and Sections branch of IOSH. Following on from a fantastic webinar last month with Heather Beach, this month we have now got Ngozi and Obi from Aurora Wellness doing managing the after effects of COVID on mental health. And without further ado, I'm going to hand you straight over to them.
Thank you, Stuart. Thank you for that introduction. Hi, my name's Ngozi. And we are from a company called Aurora Wellness. And without further ado, I'm going to share my screen with you and take you through our presentation for this session. So please bear with me while I get this lined up. And I hope you can all see this deck. So today we're going to be talking about managing the effects of the coronavirus crisis on mental health in the workplace. And this is something that all companies, regardless of size, are going to have to grapple with in the present days and coming months, as this virus doesn't seem to be going anywhere soon. So a little bit about our company and who we are. So Aurora Wellness is a mental health and well-being consultancy. And we deliver a range of personal development programs that are designed to help you have a strong and resilient workforce and improve workplace productivity. And that is because we know that physical health and safety, the area of specialty you guys all work in, is vitally important. But so is good mental health and well-being. And there's no point in focusing solely on one and not the other. We know that if you are to focus on good mental health and well-being, as well as good physical health and well-being, that is when you can maximize employees' engagement and productivity, and ultimately better influence the company's bottom line. And we do this through our 3 pillars of well-being. So pause, think, act models in our workshops, in our group coaching and our one-to-one coaching programs, which we deliver both in person and online. And we work with individuals as well as corporates like yourselves, businesses which are seeking to proactively prevent employee burnout and promote thriving workplaces. So that's our company. And we have a very clear vision, and it's to enable good mental health and well-being in the workplace for you and for your people. We want everybody to have a good day at work. This is something that my company always used to talk about when it came to physical health and safety. Have a good day at work, go home safe. We believe that that's absolutely vitally important, whether you're talking about physical health and safety or mental health and safety. And that is why we're so grateful for this opportunity to share with you guys at IOSH why it is important to focus on mental health and well-being. So a bit about me. I'm Ngozi. So my background, I'm a management training consultant, a mental health first aider, I'm a speaker and a coach. I wasn't always those things. In fact, I used to work for an oil company. I used to work for ExxonMobil as a program manager, project manager, all sorts of things. I worked there for over a decade and a half, climbing the ranks, doing what you do. I joined the company as a graduate and did a lot of work, particularly a lot of work within the Safety, Health and Environment Department, looking at how we maintain employee safety and well-being, but it was always physical health and safety and never mental. And so it came as a bit of a shock to me when I became diagnosed with work-related stress, anxiety, and depression. In other words, I burnt out. So the years I spent grafting, the years I spent sacrificing personal life, family time, all of that, in order to work on a career, to give everything I had to climbing and being more successful and progressing further within the company, didn't protect me or my mental health. They did me no good. And so I left that job and I ended up being signed off sick for a year. And this is the consequence. I wanted to give you the personal consequence, the real life consequence of ignoring mental health and well-being within your organizations, is that you end up with people who are some of your best and brightest or hardest working or whatever, unable to deliver, unable to do the job that you've become accustomed that they do, that you depend on them for doing, because they've burnt out, because they've had too much, because they cannot cope in that environment anymore. And I ended up being signed off for a year, and I never went back. I instead decided to use the things that I had learnt and experienced over that time to form this company to ensure that nobody else ever had to go through that kind of thing again. So that's my personal and professional experience. On another note, I'm a mum. I've got 2 kids who I've squirreled away with their father, so we can have this uninterrupted time together. So yes, that's me.
My name is Obi for short, and I'm a psychologist and stress management coach, and I'm Ngozi's cousin, first cousin. And of course, I had a clinical job, private practice, when Ngozi had her stress burnout breakdown from work, from corporate work. And otherwise, my previous background was working with people around common mental health issues and addiction. And what's important to note, that even though I had all this knowledge and background and experience and the rest of it, I didn't know when she was going through her own stuff. And that's because people who are starting to get really distressed or starting to second guess things that are going on with them hide. They don't share with other people because they think there's something wrong with them. And the purpose of me sharing this particular aspect of our story is that you won't know. Sometimes it's hard to find or see what the sign could be. And even though you have very much experience of it, like I did, or maybe you knew someone in the family, it's still possible to miss things. And so our work, or my part of the work, is to ensure that everybody's equipped to recognize signs, to ask the right questions, and to support properly so that people get the help that they do need. So that's where I come in here.
Right, moving on. So we want to take you through some of the mistakes that companies commonly make when it comes to mental health and well-being, because this is something, it's become a bit of a buzzword, hasn't it? Mental health. Everybody understands mental health is important. We have World Mental Health Day coming up this Saturday. It's raised on the agenda quite a lot. Yeah. As Stuart said, we've kind of done this thing to death. So if it's being talked about so much, why are the levels of mental ill health still going up? Well, these might be some of the reasons. So let's have a look. We find that too many companies make dangerous assumptions when it comes to what mental health and well-being is or should be, right? The first that they make is that assuming that because the issues that the employee has aren't directly related to what's going on in the workplace, that's something for the employee to sort out. That's something that they will take care of or get over or somehow resolve on their own, and it has nothing to do with you at work, right? So if an employee has, lost a parent, or is going through a divorce, or has some financial issues, or whatever it is, that's a private issue. It's a personal issue and doesn't need to be brought into the workplace. Now, the reason that this is dangerous is simple. As an individual employee, I'm still a human. So if my issue is at home, I have no option but to bring it into the workforce and into the workplace. I have no option about that. If I'm going through a divorce and it's taking up a lot of my time, my energy, my feelings, my finances, there is no way that I can come into the workplace and not be thinking about those things, not be affected by those things. So it's absolutely irrelevant where the source of the mental ill health or distress is, whether it's work or home. You as an employer have to deal with that issue because you're dealing with the whole human, with the whole employee.
What happens here is what we call the well-being black hole, where eventually what will happen is somebody in a workplace, in a team, for example, will attempt to do a piece of work, something happens, so they have are going through a divorce or something, and the increased level of stress comes in. A team might rally around and they might say, oh yeah, we'll help support them. But what that means is that you then spread the work that person would have been doing to the rest of the team, which is okay when it's one person doing that. When it's 2 or 3 people in the team, somebody is struggling with a divorce, someone else is struggling with some mental health, someone is struggling with an illness, you can see how it starts to swell into this team. And before you know it, it then left to the manager to then sort of roll their sleeve up and get involved in the operations of work as opposed to managing the team. And this is where it starts to balloon out. So we call it, a lot of companies that we work with, this is where they get us in, where a team that was performing stopped performing, but they think it's a stats situation or they haven't made their sales or whatever. But when we've investigated, turns out one person had a problem that could have been supported or solved, but it got left to, it's none of our business, we don't want to get involved, because they didn't offer any support beyond, hey, that's okay, I'm sorry this is going through, we have an EAP program, so let's go and do that. So this is what we know by that, okay? And that brings me to the second part of it, which is believing that simply having an EAP provision. So this is employee assistance programs. People, a lot of companies invest in them, where you get sort of an online sort of package where if an employee needs support, they can call this helpline. Some people will get a phone assessment or phone counseling. Some people get face-to-face, depending on which side of the package. More recently, they've been having mental health first aiders into organizations to support that work. Now, what we've been finding is, even though companies have done a brilliant thing by investing in EAPs and mental health first aiders, it's never quite enough because employees don't feel confident or safe using an EAP provision, or they think they have to wait for it to be really bad before they access it. And if you think about it, kind of when you're struggling, personally, if you think about all the times you've ever struggled with something, when someone said, oh, you're going to be okay, you go, yeah, I'll be fine. We say that, don't we? We don't go and pick up a phone, dial. We only do that when we have to. So when we think about a story like Ngozi, she only had to do that when she got a breakdown, what we call kitchen floor reset. Apart from that, you're just thinking, I can cope, it'll be fine, I just need to buckle up and just get it done. And these are why, when you do that, your company then think, oh, they must be okay then, because we've offered this provision and you're not using it, which means they must be fine. So that's the dangerous assumption that because your staff aren't using those provisions does not mean that they're fine. So that's mistake number 2.
And the third mistake or dangerous assumption is that assuming that mental health and well-being doesn't belong in this she arena, doesn't belong in any other arena other than HR, because it's a people thing, right? So because it's a people thing, HR should take care of it. And I work with a lot of HR managers, HR directors and business partners, and I know that's exactly what organizations tend to think, that if it's a people issue, human resources deal with it. The issue with that is human resources do not deal with your employees on a day-to-day basis. HR should be the last resort for resolving anything like this. It should only reach HR if all other attempts at support have failed. In fact, who is the best placed person to support this? It's the line manager. The line manager is the one who should be seeing that employee on an almost day-to-day basis, right? On a day-to-day basis, you are more likely to know there's subtle changes in behavior that indicate that there's an issue with that person. You're more likely to have a personal relationship with that individual that allows you to broach the topic of how are things really? HR tend to be brought in when there's a significant issue and generally not a positive one.
No.
So to then depend on HR to solve this mental health issue is far too little too late.
Yeah, I think
right?
once you get to HR, I think you're now a bit late in that situation. That's what I would say there.
Yeah.
Okay.
So looking at those 3 assumptions, thinking that employees should keep their private matters private and sort themselves out, thinking that, well, we've got EAP or mental health first aiders, mental health champions. We've had Mental Health Awareness Day, that should be sufficient. Or thinking that HR are the ones who are responsible for fixing this kind of mental health issue. Is your company making any of these assumptions? Are you making any of these assumptions? Have a think. So what do we do about it? Right, well, we find ourselves in the most extraordinary of times right now, don't we? It is unprecedented, words like never seen before. We keep referring back to the Spanish flu of the early 1900s, or whenever it was. I think it was 1914, 1917, something like that. I don't know. Okay, but that seems to be the only comparison we've had for a global pandemic like this. And it means what was up is now down, what was black is now white, and we have to find a way to deal with this new normal. Or some companies are referring to it now as the next normal, which I think I prefer, because I think what we consider normal is going to be changing on a almost weekly basis, right? So, but we need to find a way to move beyond crisis management, specifically with regards to health and safety, to actually what's going to be our steady state, what's going to be the way that we thrive given these circumstances. So this is the interesting stats stuff. I love this. So back at the beginning of this crisis, King's College London and Ipsos Mori got together and they did a survey of several thousand people, and they wanted to look at how individuals were responding to the coronavirus crisis and the lockdown measures that were imposed, right? So the way the government was responding to the crisis. How were you responding to this? And they managed to categorize, and this is UK specific, they managed to categorize the population broadly into 3 different groups. So here are the 3 groups. The largest was the accepting population. And as you can guess, these are the ones who pretty much go with the flow, and they were able to adjust and adapt. But then the second largest group was the suffering, and they're not far behind. And these, as the name implies, are the ones who struggled significantly with the whole situation, with the disease itself, with the impact it had on their physical and mental health. And then finally, the third group, the resisting. So this is the 9% of the population who really struggled to come to terms with what they were being asked to do. So let's have a look at that in a bit more detail.
So we've got the accepting, so this is the first group of people. And just, 12% of this group said they were losing sleep. They were fine, they adjusted really quickly. These are the kind of groups that would adjust to change or anything different quite quickly. So some of us in the population, this is just how we operate. So there were a few arguments with family members. They settled into the working from home culture. They settled into the homeschooling thing. And they were less likely to have financial issues. So these were people who had jobs where it was okay to transition into home working. Some people would have their furlough, but these were people who didn't have, furlough was not part of the thing. They got paid as well. So all of that stuff. They were less likely to check social media daily. They could enjoying the process of quiet, of not having to do the long commute and all of that stuff. So they were feeling, I think a lot of us felt like that in the beginning, maybe a bit more grateful with it. And then of course, 91% or 83% supported lockdown measures because there was a we needed to do this to save people's lives. And it's not so bad being at home, working from home, what's the problem? So there was this thing there. With 87% of this group saying that they following lockdown rules completely and nearly all the time. Now, bear in mind, it was April, right? When things kicked off. So then the second group here.
This was the group you were in?
Yeah, definitely the group I was in.
Okay.
So quite, it's like, oh, I don't have to do the whole commute.
Yeah.
Brilliant.
this is the group that I found myself in, was the suffering group, right? So I have, obviously, I said, a history of anxiety and depression, and I wasn't expecting it, but this coronavirus crisis saw that anxiety flare right back up again. And that's despite having been on medication for 1.5 years and having 2 years of therapy, it still brought it up. So there were 44% of the population who were with me in suffering through this. And this is how the suffering manifested. Yes, 93% of us were feeling more anxious or depressed since lockdown began. 64% of us slept less or worse than usual. My sleep is still not quite recovered. So we would have more sleepless nights, we'd have bad dreams, we'd wake up more. 34%, so over a third, were thinking about coronavirus all the time. And I mean all the time. So a package comes in from Amazon, Corona, is there Corona on the box? Do I have to clean the box? Do I have to wipe down the shopping as I brought it in? Or I think I might have shook someone's hand and I shouldn't have done. And all of this stuff, constantly thinking about it. Did I wipe down the car door? Always thinking about coronavirus and checking social media for updates. 2/3 of us checking social media for updates on the virus daily or more frequently. Compared to the accepting group, 93% and 85% supported lockdown measures and additional police powers, which is higher than any other group. And almost all of us, 93%, were following the lockdown rules completely, nearly all the time, because we were so anxious about the whole situation, right? So that's the group I found myself in the first few months. Then there's the special resisting lot, right? So everybody knows a resistor. If you don't know a resistor, maybe you're the resistor. The resisting group, only 53 and 49% supported lockdown measures and additional police powers. These are the people who are, what's all this fuss about? I don't understand, just open up the pubs already. So only 73% were following official guidance, and that compares with the 94% of the accepting and 99% of the suffering. They weren't following any of the official guidance. Yeah. They just thought too much fuss is being made out of the risk. I don't know how many of you have seen the conspiracy theories. It started in the very beginning. I saw a picture of a truck that said COVID-19 on it. And then underneath, this was on Facebook, underneath someone saying, see, I told you this was manufactured in a lab in China. My website developer has started his own WhatsApp group for the coronavirus conspiracy theories. They're going around all the time. And the resisting are more likely to believe those things, regardless of any evidence, right? And they are also most likely, I think uncoincidentally, to be the ones who will suffer financial impact because of this crisis. If it's going to hit your pockets that hard, you're going to start looking for ways and reasons why it's all just a big con or it's a big fuss, right? So that's unsurprising. So you've got these three groups with distinct characteristics: the accepting, the suffering, and the resisting. Does that make sense?
So let me know in the chat, actually.
There's a poll. Can we see the results of the poll? So most people accepting, which is really good. Lucky yous. The majority of people in the group, 69% in the accepting group, a few suffering, a couple of brave resistors amongst us, and even approximately a fifth of us in the all the above or a combination. Yeah. And that is unsurprising, because you can transition from the group depending on what's going on, either with you personally, you know, have you had COVID? Have you been, are you in relationship with someone who's died from COVID, or have you lost your job? All these kinds of things will influence where on that spectrum you are at any given time.
There was actually a very funny thought group that we were sort of tricking around, called the Embracing. They get the people who were just absolutely loving lockdown. So these were the introverts who just thought, I don't know what all this fucking about, but they could like got gifts. So they're just people as well. So that I could to just throw that in there, know that this is what it is. But what I want us to be clear on, this was April, this particular research. So a lot of us are going to be accepting now because we've had time to process the trauma of it all, and then find ways to cope. At the moment, we will now start thinking, well, how are other people dealing with it? Are we assuming that other people are equally fine? So
the question we want to know is, do you know where your staff are? So you know which group you think you belong to, or which combination of groups. Do you know where your staff are? Which group do they belong to? And how might you find out? Could you put in the chat if any of you have any idea, the bulk of your employees that you're responsible for, whether they're accepting, suffering, or resisting, or combo, or if you don't know, any ideas as to how you might uncover this information?
No, that would be interesting to learn. Okay, so while they're doing that, we're going to move in. And I'll check the chat later. Awesome.
There's a reason why I'm asking. It's because these groups are still relevant, right? So this survey was done in April. The categories were defined by then, but it's still relevant, not least of all because we haven't left the crisis. In fact, the figures are going the wrong way, right? So lockdown restrictions seem even more likely today than they did a month ago. So it's even though we're shifting to thinking about how we're going to manage the next normal, this is still an important distinction.
And then we're talking about people worrying about working from home longer, how it's going to play out, because the idea was that people were going to go back into the office, which obviously people started to, and then it reversed again the last couple of weeks or so with the new measures. So these are the reasons why we need to start thinking about this. For sure.
Thank you, Peter. My team are based across EMEA in France, UK, Poland, Spain, and Italy, and their groups have changed on a regular basis, depending upon their individual circumstances and local government restrictions. Exactly. Exactly. So, but it's important for you to have an understanding of where they might be.
So what we wanted to talk about is the psychological safety that your employees feel. We have a sort of significant impact on how they behave. So what we're saying is when we talk about accepting, suffering, resisting, it's all psychological safety. It's something about that, allowing them to cope with the problem. So we must know, or at least understand that, because that will determine whether or not they're willingness to travel to work, willingness to work on site, the ability to concentrate when they're at work, personal productivity level, because if someone is somewhere they don't want to be, their productivity level will be shot and they will be increased more presentism. So that you're at work, but you're not really at work. So that will go up. And of course, the mental health and well-being will go up because the anxiety will go up. The self-doubt will go up because the lack of concentration will go up. So this is why it's important to know where are your people really. So on the surface, they might look accepting. Are they really? And how do you, because you have to be able to ask questions so that you know whether or not they are pretending to be accepting because that's what everybody else is doing, or are they resisting because they think this whole thing, we need to get into the office, I don't care because this is where I'm going to make my money. Those things are important to know because that's how you learn how to support them. So I hope that makes sense.
And it makes an impact on the decisions that you make about whether or not you force everybody into the office or whether you allow some people to work from home for a bit longer, whether you have any provision to support them coming into work more safely so that they can go to the office. All these kinds of things, what physical safety measures you put in place will be determined in part by what the government says, but also what do your employees feel they need in order to enter the workplace and work at their best level. Yeah? Okay. So here's the challenge that we face today. And it's about, we have to have well-being strategies, right? Well-being strategies in the workplace that actually work. So you might have EAPs, you might have MHFAs, and I'm not knocking either, they're both essential, but they're not the complete solution. So this is some more, I love this research. You guys have heard of PTSD, post-traumatic stress disorder. I coined this phrase, post-COVID stress disorder, and I wrote an article about it because having had coronavirus, yeah, we were the unlucky ones in March who caught it. I know that PTSD is going to be a significant issue. So
actually, one of the British Medical Association recently, so this was about a month ago, I sat in on a webinar, just like you guys are now actually, and the concern that the doctors were having was that the pandemics had increased mental health illnesses or triggers or symptoms from 1 in 10 before COVID to 1 in 5. Now, as a psychologist, I would expect it to go up because even when we were managing the lockdown, I knew that anxiety would go up, fear would go, all those things were going to go up. But I didn't quite think it would be double. So 1 in 5 as opposed to 1 in 10. So mental health has been a significant issue. Ngozi did a sort of very casual poll on LinkedIn the other week, and thinking, okay, the productivity people are worried about, or is it mental health? And of course, it was literally what, 20 to 2 more worried about mental health than productivity. So specifically, younger people. So this research was done by Hayes earlier in May. So 25% of younger demographics reported feeling positive well-being. So that's like what, 75 not feeling that? So if you have a workforce that's quite young, then you will need to make extra provision to make sure, because that means overall productivity of a company could drop dramatically if the majority of your young force are not optimized, or their mental well-being or their productivity are not optimized. Then you had 37% of managers reporting positive well-being. Huge drop considering before, because the report will put a link to you in the comments so that you can access this report. And this was a much higher number, so almost like 67% had positive well-being, and it dropped to 37%. 40% say they don't have access to work support network, so they were working either isolated, or where they were not isolated, the team were not really bonded, so they still couldn't share things that they would have normally shared with their family member, because they were not able to access them because of the lockdown measures. And 38% thinking they're more distant from their colleagues since the lockdown, for the reasons I just mentioned. So it's an important thing. If you ever start thinking, why is it coming up more and more? This is why. It was a collective trauma, this COVID, but some people, like we said, will cope better than other people. But we need to be able to support the people who are struggling particularly, so that they don't add to the pressure, remember when we talked about the black hole, of the people who were coping. Because eventually they will stop coping if they take on extra workload from the people who were suffering.
Yeah.
Okay. Awesome.
Okay, so there's this Workplace Safety Balancing Act. You guys are all charged with being responsible for the health and safety of the employees in your workplace. And we are firm believers that that's not just their physical health and safety, it's their whole lives. It's mental health and safety as well. It's a fact, employees have to feel that psychological safety. They need to feel safe physically, absolutely, but also emotionally and mentally and financially secure. They need to be supported and emotionally secure in order to perform at the levels that we need them to perform. And we do need them to perform at top levels now, because we're facing economic crisis. We need to make sure that our companies are the ones that survive this. Then we need our best and brightest, and everyone needs to bring their A game to the office, right? In order for them to do that, we need to support all of them. 68% of companies, so this was research that was done by Willis Towers Watson back in April, 68% of companies stating that employees are reporting higher than normal anxiety levels. That's 2/3 of companies at work, their employees are saying they're more anxious. What are we doing about that? as we go to the new normal, there is going to be more pressure on you, on HR, on line managers, to take the lead on bringing the employees back into the fold, especially those who have been furloughed for up until this month, and to renew that relationship, restore that trust between employer and employee. But you've got your own increased workload, your own uncertainty about the future, about what impact COVID is going to have on your business. So it is something that you need to be very conscious of. The fact that you're busy doesn't absolve you of the responsibility of solving this for others, I'm afraid.
And I got a comment there that said from Dana, that my staff are definitely accommodated and trained over time, spread across the UK, Europe and US. It really depends on the situation at the time. Exactly. Well, thank you very much for saying that, Dana. And what we're trying to say, this was April stat. As it goes, some people will cope, some people will not. And then, but you have to be able to provide a psychological safety for everybody so that you know quickly who is not coping, as opposed to where it's gone on too long, and then, well, it's a HR thing now. And then that might take definitely longer, definitely more expensive.
Okay. So we have a philosophy here at Aurora. We call it the do better, feel better philosophy. And it's this virtuous circle about that links productivity and mental health and well-being. You can start where you like. It can be feel better, do better. But the two are intrinsically linked. If you are able to perform better, you will feel better, which will help you to perform even better, right? But it ultimately is this, that employees can't be productive unless that both their mental and physical well-being needs are met. So I know you guys take care of their physical well-being needs. Who is taking care of their mental well-being needs? And the reason we're asking is because it's not about doing the right thing only. Yes, it is a moral imperative. I firmly believe that we should be looking after the whole person, but it is also about profitability, right? It is also about the bottom line. Companies that aren't supporting mental health and productivity are not able to make the most of that individual's unique talents, and it affects their bottom line because it leads to reduced productivity because of the presenteeism we were talking about, and absenteeism. Yeah. So many people calling in for sick days and you don't really know what the sick days are. There's more staff turnover with people leaving abruptly, even in times where there is economic uncertainty. You have fewer sales, you have reduced turnover. There's the reputational damage. These aren't us making up these stats. This has all been data taken from the 2020 Deloitte Mental Health and Employees Report, right? These costs are rising. There was a 16% increase on costs in 2020 versus 2017. And these are the costs. And coronavirus is only going to make this worse, right? Because we told you, from the BMA said from 1 in 10 to 1 in 5. So if Deloitte do another renew their research in 2021, it is likely to be worse. But this is the average cost per year of poor mental health per private sector employee broken down into industry. So you can find your industry and you can see what the high and low estimate is. And this was in January before anybody had heard of COVID-19. So you know the cost is going to be higher now.
I'd double that now, because if you're saying 1 in 10 before, it's now 1 in 5, you can double that to give you a really safe margin. Yeah, because that's what I would say there. I'm going to leave the slide up for a moment, but so I know we're going to take questions in a bit. I don't know if anybody put anything else in the chat. Nope, we're good to go. Okay.
Right. This is what we're saying. Companies have to invest the same way you'd invest in better equipment, better scaffolding, I heard. Yeah, ergonomic chairs, whatever, to protect your employees. You have to invest in effective well-being strategies. So first thing, going back to those 3 dangerous assumptions, you have to recognize that mental health and safety is not the preserve of HR. It is the concern for every manager in that organization. Mental health first aiders and EAPs are good, but they are not enough to prevent the rise of workplace mental health concerns, as the figures are bearing out, because of many reasons, but largely because it requires the sick person to, first of all, recognize that they're unwell. And I can tell you, speaking firsthand, I did not recognize I was unwell. And then be brave enough to go out and reach out for help. Employees don't know their issues and their reluctance to seek help because of the culture that we have, because of the fact that mental health and well-being is something that we associate with negative connotations, and certainly we worry about the damage it will have on our careers. It is very unlikely that we will do that, seek help. The first step is awareness training. It's making people in your organization know that we as a company do not place any stigma on mental health and well-being. We recognize the importance of mental health and well-being for you and for us. So awareness training is a great first step. And the fact that you guys came on this is a brilliant sign that you understand that. What you need to focus your solutions on is empowering line managers to have open and honest two-way conversations about mental health with their staff, right? Because as I said before, the line manager sees them every day and is able to detect changes in their mood or their behavior or in their work that would indicate that something is wrong. So they need to be able to do something with that.
And that's one of the reasons why we tend to focus on the managers training, because if we can get managers to recognize signs earlier, then they can pick it up really earlier. So that's why it's particularly important. I don't expect everybody to be an expert at it. That's a lot of work. I don't expect the managers to be an expert. I just expect them to be able to isolate or at least figure out if there is change in someone's behavior and have the right tools to open conversations about that. And we're going to share a little bit about how we might be able to do this, okay?
Yeah, so we want our managers to be able to identify those red flags and develop strategies that can reverse the impact of stress.
So
these are some of the strategies.
Some of them. So we're going to get 3 of them, very simple. And this is for forward-thinking companies, because companies who are interested in learning more, companies who want to help. Okay, it doesn't work if you're not. That's why I wanted to share that. So to improve employee mental well-being, there are 3 things you can do, like today. One of them is talking to your team openly and regularly about mental well-being to remove the stigma. That's the first thing they need to eliminate, the stigma of it. So what that means is when you have weekly meetings or daily briefings, whatever it is, you allow a space to say, how is your mental well-being or how is your mental health, how are you feeling? And really ask the question, not just, oh yeah, I'm all right. That's not a response. So you have to allow a 15-minute window. If you say, hey, for the next 15 minutes, we're going to talk about our mental well-being and how we're feeling. Because that allows you to be, oh, I'm not just fine. That's not a response. You want the dialogue to start coming up. So if you allow this regularly, then people get used to using that space to share their thoughts.
And the key to this is leading by example, which sounds damn scary if you're an introvert or not used to opening up about your private life. But people need to know that they can trust you with that information. And the way that they can trust you is by you sharing your mental health and well-being in those team meetings. So it's not just tell me how you're feeling, but it's by saying, I'm going to start. I felt pretty crap today. Yeah. So that's 1. 2, highlight the support services that are available. So your company may well have MHFAs, mental health first aiders. You may well have EAPs. But does everybody know how to access them or when to access them? Do they know whether it's free? Do they know whether they have to pay? Do they know about it? Because these tends to be things that we keep in our HR policy. Yeah. And they're not lived and breathed. So remind everybody that you have these things available if you have them.
Yeah, okay? I would even say be specific about what's in there, not just we have this support. What support will they give and what will it cover? Does it cover support if you're going through a divorce? You want to be able to share that with your team about what it is they can and can't support. But at the minute they do have a struggle, and also clarify that they don't have to wait until it's a big deal. They can literally just call for a 10-minute chat for someone independent. So our point of saying this, whatever resource you have now, utilize it. You don't have to go and do or buy anything extra in that sense if you don't have to, but it's making sure your teams are aware of exactly what support they can access and when.
And finally, ask them. Back in the beginning, we asked you, do you know which of the 3 groups your employees fit into? Have you asked them? Survey your employees frequently and find out how they're actually doing, because we tend to make assumptions as managers. We tend to just think we know how everybody's doing, but there's nothing better than actually getting that qualitative data direct from the employee. So survey them and find out where they're struggling, how they're feeling. Use that information and point them to the support services that you have on offer. And if you don't have support services on offer, start thinking about how you're going to close that gap. Yeah? So those are the 3 things. Talk openly, honestly, regularly, highlight the support services that are available, and survey your staff so you can find out exactly how they are feeling. And this is the crux of it. So Paul Dreschler is he's a former chair of the CBI. And he said, good health is good business. And I want to go a bit further and say good mental health is good business. Because as I've said before, without good mental health, the rest is irrelevant. Okay. That's our
we're going to take
presentation.
Now, if you have some questions.
I'll stop sharing now.
Awesome.
Thanks for that, Ngozi and Obey. Absolutely brilliant. Some real good food for thought. Some of our attendees have got some great questions for you. Melissa would like to know, what would be an acceptable way to proceed when someone bringing their personal issues into the workplace or affecting morale in the workplace because of the way they are behaving and approaching others?
That's a great question, and that goes exactly back to what we were talking about, Melissa, the well-being black hole. You as an employer or as a manager, you want to deal with work-related stuff all the time. But the fact is, your employee is a human, a whole human. They cannot help bringing their whole self to the workplace. Some of us are better at segregating, cutting off and boxing off than others. But what you have to do is do exactly what we said. Sit down and talk with that employee. Yeah? The fact that it's having a knock-on impact on everybody else, is inevitable. Yeah. But you need to start with talking with them, and they can't help that they have an outside external issue. I don't know what that issue is. I don't know your history with that employee, whether that employee is just known to be difficult or whatever. But you start by talking.
Yeah, I mean, one of the ways when we do this with teams is the person who has the real issue, at that point it's too late now, right? Because it's already created a dynamic. That person needs to be supported separately. So, and again, if they couldn't trust to talk about what was going on, that's why it became like that. So what I would say is isolate that person first, intended. You need to talk about, okay, what's going on? How can I help? And you need to do it like that. How can I help?
Yeah.
As opposed to you're not, look at another person. Imagine it's a family member. Can you share stories? Can you say, listen, I understand what it's like to go through a divorce. I had one 4 years ago. It was awful, so I get it. I just need you to tell me how I can help. Mm-hmm. We have an EAP program. Look at exactly what they do. Definitely call them. If you used them before, say I've used them. They were brilliant. They did this, they did this, and this. That allowed them to feel, okay, it's a circle of trust. As for the rest of your team members, you now need to allow them to have empathy. But the point of us saying you must have team meetings to discuss it is to start the work. You don't do it when the thing has hit the fan. So you have to create a safe space from the off, even before there's a drama. But if people get used to telling you things quicker, because they can say something's going on at home, and you can say, okay, what are you doing about it? Have you called the EAP number that we gave you last week? Why haven't you called them? Do you want me to call them with you? You wanted to, let's go to the office. I'll call them, I'll be with you while you do it. Because sometimes we do need someone to handhold or hold our hand while we do stuff like that. Because that's what I would say, 2 points there. Take that person and say, what's going on? How can I help? Find out how you can help first before you go over there. If you have EAP, find out. If your company can support with counseling, find out what the budget's gonna be. That way you can say, listen, I spoke to them, they will do this and this and that. That way, and then you let the other team say, if anybody else is struggling, please let me know, let's help you before it gets to this issue, blah, blah, blah. Did that make sense? I hope it helps.
I'm sure it will. Melissa will clearly take that on board. I'll be talking to Melissa later, so we might be able to give you some feedback on that. I suppose with any health and safety subject, dealing with mental health and well-being, there'll be a challenge, just like any other health and safety challenge in changing culture, and it takes time to change culture and change attitudes, and that communication seems to be at the heart of what you're talking about. And it doesn't happen overnight, and creating that place of trust is absolutely key to that. It seems coming out of that. Tom Beswick-Brown, is the question of making mistakes not dealt with in the training for the mental health first aider?
Is it a question of making mistakes not dealt with in the training of the MHFA?
Yeah.
Okay.
I'm just going to be honest there.
Okay. I have done the MHFA training and it's brilliant. You get a 2-day course and you are completely immersed in mental health, mental well-being support. It's a great course. What it doesn't do is make you a psychologist. What it doesn't do is give you first-hand lived experience. What it doesn't do is make you an expert. And what it doesn't do is take away all of your own problems, right? So it's not perfection, Tom. And yes, making mistakes is something that they do touch upon. Maybe it was just my trainer, but you do touch upon the fact that, yes, you might not always get it right. But bear in mind, people either get picked, you're going to be an MHFA, come and join the course, or they volunteer, but they still know that they've got a weight of responsibility, and it's quite frightening. And it depends on what the person comes to you with.
Yeah.
Like, you might have been trained 2 years ago and suddenly someone, their flatmates committed suicide, and you're the mental health first aider and you've got to deal with that. You can't really remember what the training is, and you can't really go, hold on a second, let me just check in my book. This is what it said. So, and
even if you could check your book, it's fine. No harm in doing. I still check my book sometimes. But here's the thing, I know where to go to offload that stuff. I have inbuilt support to say, right, I got this patient come in, he said this, and this. What was that? What do I do? And I can freak out in a support session.
Mm-hmm.
But MFSA don't have that support. And that's the kind of thing that I want, at least if I thought they had support, I'd champion it all day long. Because at least they get somewhere to upload. Can you imagine if 5 people have spoken that day about something or the other? They take it home. Mm-hmm. There's nowhere else for them to upload, and they take it home, and guess who gets it in the neck? It's their family members who's going to get it. Mm-hmm. So it makes sense, John.
I guess the thing to add to that as well with mental health first aiders is it's not what you say, it's how they hear it. And that depends on that person. They might have had the training, but we're all different in our own way of actually vocalizing it, and that could have a massive effect as well.
Absolutely, yeah. Awesome question.
Okay, we've got a little bit of time left and still got a few questions. Emma Christie asks, what do we do in cases where the company isn't the issue? That is where we have laid everything at the employee's feet, yet they almost refuse to accept the support.
Now, this is a tricky one, okay? So I explained that I had my own battle with anxiety and depression. The company was, in my opinion, entirely to blame. The rest of my life was fine, it was work. But they were not aware at all. So they didn't provide any support, even though they had the support available, right? So there was nothing they could do. Even if they did provide the support, I'm not sure I'd have taken it because I wasn't depressed in my mind, right? So this is what I was saying to you. If you've laid all the things out and they still aren't taking it, it's because maybe they aren't ready to, they aren't able to. You can't force them. It was that expression, you can lead a horse to water, but you can't make them drink. You cannot force them.
You can. And let me add, look at the question I think I want to ask. If they refuse, they're not producing the good, they're not productive at work. So they are not doing the work, that becomes a disciplinary issue. Okay? So whether they had a mental health issue or not, it's almost irrelevant if you're not taking support. So you have to activate what the disciplinary issue would be, where you get HR. But the question that a lot of people just don't do it early enough. So this thing drags on so much that it becomes an unfair situation to now put someone in the disciplinary, as opposed to, you said you have A, B, C problem, we've offered you this, this, and this. Tell us why you're not able to access them. What are you resisting? Is there something else we can do for you? Because this is how it's affecting the rest of the team. And if it continues in this way and get to this stage, we will have no choice but to activate X, Y, Z.
Great.
And how do you feel about that? Is this something you wanted to go ahead with? And they can say, yeah, go on then, because I can't cope with this. And that becomes your permission to activate whatever you need to do that.
Just listening to that, and although, you know, we do have a lot of mental health presentations over the course of the year, each time there's a new aspect of it, and this has brought a brand new aspect altogether. And in particular, a term that I haven't come across, and I guess we're going to hear a lot about it, and that's collective trauma. We do hear a lot about individual trauma, PTSD, and whatever individuals have, but there is an element of collective trauma here. It's a whole demographic of people that are suffering this way, and that's something to be thinking about. The other thing to be thinking about is the fact that if you're within a company, we are here and we are listening to what you're saying, and we can give that advice. But for all those people who lost their jobs throughout this, they're on the state, and unfortunately they're outside of that. And I bet that's an iceberg when you look at it over the course of the year. So thoughts go out to those people who lost their jobs, who are suffering these things and cannot get what we are going to be, you know, the benefits of this presentation. And finally, for IOSH Manchester, we're setting a standard with these presentations. We always seem to try, and we've hit a level now that is doing so well, and we've got some great ones coming up as well. But this year has been one great year of presentations that have been of a very high standard, and this is the next one in the bunch. Great presentation.
Thank you.
And fantastic outcomes and fantastic takeaways for everybody. Just for everybody else, thank you for joining us again on our session. Next session is going to be Rachel Valentine and Rebecca Stevens doing a 4-part series of presentations, what I call the binge watch of safety. If you're lucky enough to catch the first one, I'm pretty sure you'll be in for the second, the third, and the fourth. It's a chartered psychologist meeting a chartered member of IOSH. And I think that's going to be an interesting series of presentations coming up. And finally, thank you all for joining us, and have a great rest of the week.
Thank you. Take care, everybody.
Thanks, everyone.
See ya. Bye-bye.